Okay, so my name is Tilman von der Linde and I'm a registered massage therapist and I'm working here at GF Strong on Corey.
My name is Corey and I'm giving Tilman permission to record this for educational purposes.
Okay, and for future reference?
And for future reference.
For your caregivers?
For my caregivers.
So that's right.
And other people.
Corey, what kind of injury do you have?
I have a C3, C4 incomplete injury that happened in June 2nd, 2022.
Yeah, and what's with your body here?
My body is full of spasms and all twisted up. I did my injury a year ago, but I did not get any kind of treatment until recently, in the last month.
Yeah.
I was going to put on the shelf.
Yeah, okay. So time to get you off the shelf. Enough of the elf on the shelf stuff, right?
That's right.
Okay, so the reason why we're recording this is because last time I worked on Corey here, I managed to make his spasms go away, and I think has to do a lot with distracting the body from being in a spasmic mode, and then the brain kind of realizes this, and the rest of the spasms go away. And so if you wanted to look at an example, it would be the mirror box that is used for phantom pain in an amputee, where if the phantom limb is put beside the box and your other hand is working, then it might look like the phantom limb is actually working, and that way the pain goes away. So it's distracting the mind on the amount of spasm in this case. There's no paperwork, nothing written about it, but I just thought I would try it, and it seemed to work. And this is the second time that this has worked. So there was another client earlier that had the same kind of thing. Anyways, so this spasm here, well, it's not so bad today, but
Move it around, it'll get there.
yeah.
So I should be working my legs.
Okay, not a big deal. So see, there we go. Okay, so that's the extent of the spasm. You can see this fully happening here. So it seems like the problem here is in the legs, and it's pretty well impossible to get his legs apart like this. So what I'm going to do first is I'm going to stretch out the legs here a little bit, and then strap them to the side of the bed to reduce the amount of spasm, and then maybe we'll get some work here. Okay, so let's get this leg here. The left side is a little bit more spasmodic than the right. Just work with the hamstrings first here a little bit.
I don't know if I should see this, but like, I wake up every morning and my brain and my body knows that my body isn't working right.
Yeah.
But with these kind of exercises and this kind of stretching, it's really the only time I feel that my brain and my body feel somewhat normal.
Mm-hmm. So Corey's toes are also crunched over like that, and at least they're a little bit more pliable this week. Last week they were just really, really compacted. So it's just one treatment has already made such a difference here. It's incredible. All right, so now we're going to, that should look pretty good. Okay, so now we're going to use the Santa belts. Okay, and so this is a mobilization strap that I have here, and you can get them from a course that is on blanking on it right now. Anyway, so we're going to strap in this leg here.
Perfect. I gotta run and give meds.
Okay, bye for now.
Come on. Yeah.
Okay. Okay.
I'll close the door, maybe.
Yeah, I can close the door. All right. So one leg's going to be strapped to the bed.
Well, if I have time, I'll try.
Okay. And now, let's see about the other hand here. Jeez. Almost here. Okay, and this one will move over gently. That is not an issue.
For this guy. Hi, Corey.
Yeah.
Yeah, I keep so for Neil. Oh no! He gonna hang you, Corey.
And strap him in.
Do you want me to close the door or?
Yes, please.
Okay. Privacy.
Privacy is always good. Too much. Okay. Now we're going to slide this one. Well, it's going to fly here. That's a better position for this strap here. So now the body is strapped in and the adductor spasms are being tested by the brain, and the brain's probably saying, what's going on here? How come the spasm is not so bad here anymore? So we're just going to let that rest for a minute. How's that feel?
Feels good.
Yeah? Right. So now I'm going to straighten out his body a little bit. There we go. How's that? Huh? So, can you move your head from side to side?
Not so much to the right, but to the left.
Okay. So take this pillow out here. turn it to that side. And now to this side. Okay, good. Okay.
I slept on the shoulder there on my last night, dude.
You did. So we're going to put the arm outside here, and we're going to work on the other arm too. How does that feel, Corey? Does it feel like it's really, really tight, or is it
Yes,
really,
it's
strong?
really tight within my chest and my tricep.
On your tricep?
Yeah, the tricep. And
This part here?
Yeah.
Okay. And chest?
Chest
in
and
the front or in the back?
Kind of like more to the front. Back there is pretty good too.
Okay, but here in the front?
More like the down the side of my rib cage almost.
Okay, rib cage. Yeah. Well, it's not oftentimes that you get your hand put over your head, eh?
No, it's only happened 3 times. And every time it's you.
All right, let's try the other side here. How's that foot? Okay. Let's move it back over into the center here. Bend the elbow. Straighten the arm. Push the arm straight down like that. Straighten the arm. Okay, bend the elbow. Bring your hand up. Up, 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 up. And straighten the arm. Let it fall down. Let it fall down. Okay, now bring your hand up. Up, 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 up. Good, good, good. And down. Let it go down. Let it go down. Let it go down. Okay, bring the hand up. Up, up, up. That's it. Good. So you've got some good deltoid, some biceps going there. Okay, and again. Okay. There you go. Good, good. Right. And we're going to bring it up here like this. Where do you feel the tension here? Pectoral muscle?
Pectoral and shoulder.
The shoulder, where? Back of the shoulder or the top of the front?
Top of the front.
Okay. Is it a strong sensation, or tearing, or burning, or what's going on?
Just stretching right now.
Yeah?
This feels super tight. The other side almost felt worse.
Is that right?
Sorry.
Hand to the side here. Bring out. Okay, now bring the hand to your belly. Bring it to the belly. Belly, 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 belly. Good. And now to the side. Okay, and bring it back. In belly, 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 to the belly. Put it on the belly. And out to the side. And bring it to the belly. Bring it to the belly. That's it. Good. Right. Try again. Belly. Belly. Come on, you can do it. I'm resisting a little bit. Come on. You can do it. Pull it, pull it, pull it, pull it, pull it, pull it. Okay, good job. Yeah. Because it's an adductor spasm, he's going to be stronger with pecs just to hold, to bring it in. With spinal cord injuries, it's always the lateral side of the muscles that are going to be weaker. So any kind of movement that is coming out to the side is going to be a little bit weaker, not only because the adductors are a lot stronger. So pecs here are going to be strong. Serratus anterior, deltoid, latissimus dorsi is going to be strong.
Makes a lot of sense.
So in this case, because the leg adductors are stretched now, I'm hoping that the rest of the body is getting the idea that there really isn't any need for this much of a spasm here. Where's the pain?
No pain.
No pain?
Just
What, the stretch?
stretching my spasm in here.
Okay. A little higher, a little higher, a little higher. Down. Okay. So hand to the belly. Okay. That's not that strong yet, eh? Okay, okay. Push the hand down. Straighten it out to the floor. Okay. Now bring your hand up. Up, 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 up. So in your mind, this is a good training to do for people who don't have that control yet. Just say, in your mind, push the hand down to the bed. Okay, now in your mind, bring it up. Bring it up, 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 and down. In your mind, that's it. So what I'm feeling here against my hand is there is some muscle activity here, and there is some pressure on my hand, more than just the weight of the arm. So push down. Push, 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 push. That's it, good. And now bring it up. In your mind, bring it up. In your mind, that's it. Okay. Perfect. All right, so now,
Same time.
how's that feel, Corey?
It feels good. My left shoulder's a little tight.
A little bit tighter than the last time, eh? I think we overdid it last time.
No, I slept on it wrong last night.
You slept on it wrong?
Last night.
Well, tonight you're going to have to sleep right on it, eh?
Okay.
Right?
So
Okay. Going back down again. That's it, resting. And let's do another stretch up. Okay, in your mind, stretch them up. Okay. So here we got his hands at the top of the bed. Come back down again. And again, up. And down. So you might think that massage therapy is all about massage. Well, yes it is, but it is, what is massage? It is stretching. When you're working your hands over the body and the muscles, you're actually stretching the muscles.
I'll close the door.
And this is also another way of bringing the joints through its ranges of motion.
I want to see. Good. Okay, let's do this one first.
No, I'll put it on.
Okay. What do you need?
Applying a little bit of pressure
Just
here
in
on
case.
the pectoral muscle, just to fatigue
Just
the
in
muscle.
case.
Yeah.
So did you use this one last night?
Yeah.
So it's working? So did you find another machine?
No, he did it manually.
Right?
Also in the morning?
No, I don't do it in the morning.
Oh yeah.
And I don't need it tonight. I got my trick out. Right,
Wait.
sorry. I do need it.
Okay, let me double check, okay?
Yeah, I don't know of course.
Yeah, let me double check.
Also, my hand is killing me. I really need some more hydromorphine.
Hydromorphone. Can you access the omnicell? Hydromorphone. You don't? Okay. I'll do it.
Okay.
Hydromorphone and then what else? That's it. Okay. No Tylenol for you?
I've got the,
Okay, now we're going to put one more strap on.
Methadone that will be.
Is it new?
I don't
No, we're going to put the strap through the back.
Okay. Do you want the methadone too?
Yes, please.
No.
Okay. So for him.
I really like this part.
You like this part?
I like this part a lot.
Okay. So obviously you can see that the torso is also a bit of a wreck. Strong. There we are. And use my backside here like that just to straighten out the torso.
Prostate cancer is one of the most commonly diagnosed cancers in men. This September, for Prostate Cancer Awareness Month, Movember has teamed up with Sportsnet to help men talk to a doctor about how prostate cancer may affect them. Unbelievable season for Aaron Judge a year ago, as everybody remembers.
Feels okay?
Feeling great.
American League, and he's sidelined by injury though for over 40 games this year. And the numbers, they're still very good. He's still very dangerous, but obviously not the historic kind of season that he had a year ago. This is the first year of the new contract.
So using my backside here just to push or to pull, and that's straightening his thoracic spine, and I'm levering it by stabilizing his shoulder and his neck. Not pushing on the neck, but stabilizing the neck. The effect is on the rib cage and the torso. You feel a stretch?
Oh, you go harder actually.
No, but is it stretching?
Fine.
Yeah? Don't want to break anything.
Oh, yes.
Couple stretches. Mobility belt.
So no Texas, no Seattle, no Houston. They're all idle tonight. The Rays, who are hosting the Blue Jays tomorrow, they played earlier. They walked off the Angels.
All right.
Elbow surgery, and one chip's taken out of his elbow, and he didn't have a complete rehab.
we're going to nudge, I have to adjust, okay? So that would be like around 10:30,
That's fine.
okay?
Do it till 11.
See, there's a change up there. Just a bit more.
Mm-hmm.
And it always felt like he stopped pretty well.
Okay.
So 2 down, here's Mallard.
Are you ready for your dinner now?
Yeah,
His
I'll
first
wash it down with apple juice.
against the Blue Jays. He was
I,
Tampa Bay back in
I didn't drank much at all today.
hit it off. There's a last round pass.
So he told you that
Same
it's
condition.
2 o'clock. And you can also see that on the cell, the record, that it was
Listen, I'm not having any
the one.
spasms.
Hmm?
I'm not having any spasms right now.
No spasms right now, right?
Apple juice?
Yes, please.
2018. He made 52 elite appearances in 2019, a little bit of time in 2020.
All game?
Has not been in the big leagues.
Well, this arm here is still a little bit restricting.
Ready?
Holy cow.
I have to double check that reading, okay?
Uh-huh. I know, you know, Jeremiah?
Mm-hmm.
Oh, you saw that last night?
Yeah.
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 That's
Was
the
that?
last I know.
It's great.
So it was
I
Mickey
feel that on
Mouse.
my lats.
On your lats?
Let me just put this one here, okay?
Yeah.
My lats and my, it's in my triceps. It's on
Where
my
is your water
shoulders.
bottle?
A lot of my lats.
Okay. I'll go and grab water for you.
Lots,
One more
lots
time
of
with the stretch here going up, hold.
You just sign the bottom. Great. Here as well.
Okay.
It's just for practice signatures.
Okay.
One more here.
I'm gonna sign it after the picture, Frank.
Okay. And how's that spasm here? As soon as I put the pressure here,
It's not as bad. Like I can feel the spasms coming on. My whole body gets really tight.
yeah,
But it's not. See, it was at a 60% before. It's at like a 35.
all right. And so if I move this leg here, is the spasm coming back at the shoulder or
It's
arm?
turning in the back. Like it'll do well do it, but it's not what has set me off earlier. For sure.
In his 13 games
Yeah.
played here in the Bronx from 2022 to 23,
It's almost like I feel it in my hips.
Yeah.
My hips and my quads.
Yeah.
But he hasn't always been so comfortable in this environment. The first time he ever played here, wild card game, 2015, as a member of the Astros, he told me, I was so terrified.
So you had some movement in the hands after the last treatment, eh? What was happening there? You moved your two fingers and
I've been able to move my two fingers, but I had more movement in them. I was able to kind of twist them, and I had a little bit more movement in my like, actual forearm, I guess you'd say.
sure.
From Connecticut, lives in Connecticut. I bumped into his dad last night. Got some support in the ballpark as he leads off the board.
So in this case here, without strapping the legs to the side of the bed, I would not have been able to move the arms over his head. You know? And also by moving his torso here like this, that would have gone into spasm here again, same way. So, very simple solution that has a profound effect, and I'm glad I discovered that Corey responds well to this kind of work. So in future, if anybody's working with him, try stretching out the hamstrings first, and then strap his legs to the side of the bed, and then you can work his arms and shoulders really easily. But that's not a problem. That wouldn't have been able to have been done hand behind his head. Doing it.
I'm so relaxed when I fall asleep.
Okay, so more to come. Okay, so now we're going to take off one of these straps here. There you go. Mike Dixon, this is the person that you can call. He has these straps. Okay, he's a registered massage therapist here in well, he's in Tilman. But his name is Mike Dixon. He sells them. He has a nice course on arthrokinetic mobilizations. Alright, so yeah, I'm going to bring this arm out to the side here. I'm going to bring this knee up. That. Okay, and now I'm going to work on the adductor muscles here a little bit. I'm going to place my finger on the posterior side of the adductors, give it a little tension, and then rock the leg back and forth. So I'm just holding the adductor muscle and allowing the muscle to massage itself by moving the leg in and out. Like a self-massage technique, although he's not massaging himself, but I'm assisting just by tethering that muscle, the adductor muscles, starting at the hip and then working all the way down to the knee. Go back in here, sorry. Just there. Hey Corey, you asleep? No? No? Just resting?
Yep.
Yeah? Okay. Notice how much tension there was before with the spasm. Still a bit there.
And a lot less. I just feel it is a lot less.
Okay, percentage wise?
I'm probably under 20%. My back doesn't want to spasm out. My lower back gets really tight when I roll my spasms. And right now it's really not that tight. It's a little tight, but nothing crazy. Probably like 20% out of 100. But after with no exercises or anything from anyone, it gets up to 100 real quick. I'll take a day or two. Like after a weekend, it gets really rough.
Yeah. So after a weekend here, because you're getting
around, right?
you're getting physio every day, and then there's nothing on the weekends. And stretching out the gluteal muscles here a little bit. Gluteus medius. Pretty good, huh?
Very good.
Okay, put that leg down. Okay, let's work on the other one here. Take the strap off. You want to go to a good course, learn about this? Look up Mike Dixon. He's a great teacher, and he'll show you how to use these wonderful belts. Santa belts. Alright, let's move this one here. So here the spasm is not as bad as on the left side.
It never is. The left side causes more lot of problems. It
Yeah.
feels just as tight in the quads, but the left side is what triggers off the spasms.
So my thoughts are is if this person is strapped in every day for an hour, just even an hour, every day, then his body is going to, or his brain is going to realize that his body isn't as in spasm through the hips anymore and through the lower back, and hopefully the spasms will become less and less, where he'll be able to actually gain some movement back. Okay, can you move that kneecap there on that side?
There's a lot more last time.
We push down.
Yeah, that's good.
Allows this point up, which is different.
Yeah. And can you push?
I push down.
You can push down and roll.
Which is
Yeah. Well, it's hard to do when the nerves are injured, and it's harder to do when the body has become weak.
well, it'd be just that little bit that I just did. Like that's not a normal thing. Pushing down's easy. But pulling up, I think it's yeah.
That's where you got to use the legs and the hands. You say, all right, in your mind, bring the knee up into flexion, and then back down again. Push down, push down, push down, push down, push down. Okay, and then in your mind, bring the knee back up again. Up, 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 up. Bend the knee, bend the knee, bend the knee, bend the knee, and push down. Push, 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 push. Push down, push down. Okay, and up again. Bend the knee up. Bend the leg. That's it. And push down. Okay, in your mind, bend the knee up. In your mind, bend the knee. Bend the knee, bend the knee, bend the knee. Good, good, good. And down. Okay, we're going to do that same thing on the other side. Okay, in your mind, bend the knee. Bend the knee, in your mind. That's it. And push down. Good. And bend the knee, in your mind, bend the knee. Bend the knee. In your mind, bend the knee. Good. A lot easier. Don't have to fight him as much. And now push down. Push down. Push the leg down. Push it down. Push it down. That's it. Good. Okay. Now again, in your mind, bending the knee. Bending the knee in your mind. Good. And push it down. Okay. Good job. Good treatment today. Right, until next time.